Melbourne is one of the eczema capitals of the world. For whatever reason, eczema seems to be much more common in Melbourne than almost anywhere else on the planet, and many people find when they move to Melbourne they start to get eczema for the first time. It might be the low humidity in the air, it might be the pollens, who knows, but it's really common. Somewhere between 15 and 25% of all children will get eczema, and somewhere between 5 and 10% of all adults will be living with eczema. Eczema is a problem with the skin's barrier function. So the skin barrier is there to keep the water in, because after all we are 80% water, and if we didn't have an effective barrier it would just be a puddle on the floor. So to keep all the water in we need an effective barrier, but the other thing that the barrier does is it actually keeps allergens and other unwanted chemicals out. Filaggrin is the gene that produces the largest component of the skin barrier. While most people have 2 copies of a filaggrin gene in every cell in their skin, people with eczema only have 1. And if you've only got 1 copy of the gene in your skin, then your skin barrier will be normal for most of your life. But if you disrupt the skin barrier, it doesn't have the same capacity to repair itself as if you had 2 of these genes in each of the cells in your skin. So when we treat people with eczema, one of the things that we really focus on is moisturizers to try and restore the skin barrier function. The other thing we use are anti-inflammatories to try and reduce the body's natural defense against these chemicals and reduce inflammation. The most common anti-inflammatory cream used is cortisone cream, and whilst highly effective for the vast majority of people who use it, some people develop side effects or complications from it, or find that no matter how much cortisone they put on, it still doesn't work. So for those people, there's some new innovations, and we're now starting to see specific treatments targeting those inflammatory pathways. We now have injections that target interleukin-4, injections that target interleukin-13, and medications, tablets, that target the JAK-STAT pathway. And so if you do have severe eczema, and you were dependent on cortisone creams or even cortisone tablets, and you were developing problems with them or side effects or finding that they just weren't effective, then now might be the time to revisit your dermatologist and ask about some of the new treatments that are becoming available for eczema, including some of the new creams that are not steroid based that are also proven to be highly effective in treating people with eczema.